Good morning, everyone. Thank you for joining us today for an exciting presentation that we have pulled together for you. I am Maureen Ogada-Ndekana, and I work with ABT Associates as the Chief of Party for the Shops Plus project here in Tanzania. Today, I am joined by my colleagues, as well as partners that we have worked with over the past 5 years, and our aim is to present an end of project review. In the next 90 or so minutes, we will be talking about our efforts to improve access to priority health products and services through Tanzania's private sector. This will include us sharing the results we achieved, some of the lessons we have learned, and the future directions that we feel we need to travel. Next slide, please. Just as a quick scan of today's agenda, we will start with an overview of the project, focusing on our high-level results and areas where we made the most progress in moving the needle on private sector health. We will then transition to a series of presentations that will be made by 5 of our partners. Each of these partners will speak to the impact that was achieved through Shops Plus efforts, as well as share with us what their plans are on moving the work forward now that the project is coming to an end. Following these presentations, we will open the floor for questions and then wrap up with some concluding remarks from Jean Pius to offer USAID's reflections on Shops Plus work. Next slide, please. So you should expect to hear from a variety of voices today. So just as a quick introduction, this list includes myself, Maureen, who by now you already know. We will also hear from Machumu Miyeye, and Machumu is the National Commodity Security Coordinator for the Reproductive and Child Health section at the Ministry of Health. Machumu has been and continues to be a key leader in the efforts to improve government stewardship of the private sector and to promote a total market approach. Toi Ruvumbagu, who is the head of business banking from CRDB Bank, will follow. CRDB is the main financial institution that we partnered with to increase private provider access to finance in the country. We will then hear from Sumitra Ghosh, who is a Shops Plus senior private sector advisor. And Sumitra has, in the past few years, provided technical assistance to our social marketing partner, Tmac, and helped them to strengthen their financial sustainability and adapt enterprise practices. The panel also includes Samuel Ligmas Koyo, who is the NIMAT coordinator with the Director of Nursing Services Office at the Ministry of Health. Ligmas facilitated many of our efforts to capacitate private providers to offer an expanded range of HIV services. Finally, Peter Gondwe, who is Sykes Limited Senior Sales Executive and Application Specialist, will speak to their work in collaboration with Shops Plus to facilitate market entry for Tanzania's first commercially distributed HIV self-testing product. Next slide, please. So I'm here to set the stage for our partners. So I'd like to take the next few minutes to scan through what our major highlights, our milestone, and our results have been. Next slide. I do not intend to spend too much time on background today, and that's because all of you have at some point had the opportunity to interact with Shops Plus work, be it here or globally. I do, however, want to take this opportunity to share some high-level information on what our journey of work has looked like in Tanzania. We started implementation in 2016, and this was during the first year of the Shops Plus Global project. And since the start, we have managed a collection of both field support as well as core funds. These have included funds from the Office of HIV and AIDS, the Office of Population and Reproductive Health, the Maternal, Child Health and Nutrition Office, as well as PMI. The work was implemented in close collaboration with local partners, some of whom are present here today, and has been carried out by organizations across the Shops Plus consortium led by Abt Associates. Next slide, please. A number of our efforts were informed by the predecessor Shops project, which had identified a number of challenges in Tanzania's private health sector. And this was done through the private sector assessment that was conducted in 2012. Some of these challenges included the fact that government lacked timely and accurate data on the private sector, and this in turn contributed to a poor understanding and widespread mistrust of private sector motivations. There were inconsistencies across the policy and regulatory framework that resulted in varied levels of engagement by health area. Additionally, private providers had widespread challenges managing their businesses, and in turn, these had implications on their ability to access capital and invest in their expansion. Through the capacity building lens, the assessment revealed that private providers generally were not trained to deliver HIV integrated care and treatment, and they also lacked capacity to deliver long-acting family planning methods. Lastly, substantial levels of subsidized commodities that were donated were not always targeted in their distribution, and therefore often undercut or crowded out private commercial products. Next slide. So the matrix on the slide you are looking at right now offers a quick overview of our field support program, which was aimed to increase the provision of priority health products and services through the strategic expansion of private sector approaches in Tanzania's health system. So to achieve this objective, we as a project pursued two intermediate results. Our first intermediate result aimed to strengthen the capacity of private sector to provide these priority health products and services. And the project's approach to this was by improving the clinical as well as the managerial aptitude of private sector actors, and on the other hand, improving the viability of private health businesses. Our second intermediate result aimed to improve the enabling environment for private sector actors in Tanzania's health system. And our approach to this included, one, improving public-private engagement to facilitate opportunities for the private sector. And secondly, advocacy efforts to improve the policy as well as the regulatory environment for private sector actors. Next slide, please. So through our work, Shops Plus sought to, I would say, move the needle on private sector models in the 5 areas highlighted in the slide that is projected right now. And during the next session, each of our partners will speak more to some of the challenges as well as the strategies that we pursued in each of these 5 areas. For now, I'd like to highlight some of our key approaches within each of these 5 areas in order to give you a concrete idea of the depth of the work we have done over these past years. Next slide. So as I mentioned a few slides ago, the 2012 private sector assessment and some subsequent work done in country highlighted several gaps around stewardship. These gaps included a lack of data and a lack of insight into the private sector. And what this did is that it resulted in high levels of mistrust and an incomplete policy framework for private sector engagement in the country. While the predecessor Shops project had made some progress in this area, our challenge was to take these initial efforts and really embed them throughout the entire health system. To do this, we had to engage a broader set of stakeholders, convince them of the need to better engage private sector, and then support reforms to make the needed changes. Actually, on the right is a picture of a Shops Plus private sector advisor leading a discussion at a family planning multi-sector forum that was held a couple of years ago. Miyeye will speak more specifically to this work, but broadly, our aim was to strengthen platforms for public-private dialogue by including more diverse members in order to produce more effective and meaningful engagement. We also facilitated the generation of new data on the market in order to increase awareness both about opportunities for improved private sector engagement and, on the flip side, create awareness on the costs of not leveraging these opportunities. We further used evidence gathered to advocate for improved policies and improved guidelines. Next slide, please. Shops Plus also sought to address the challenges that private sector faced in operating viable business models. Led by our partners, Banyan Global, Shops Plus delivered business as well as financial management trainings to nurse midwife-owned facilities, accredited drug dispensing outlets, and other private providers. And each time we did this for each of these sets of providers, we did it with content and delivery mechanisms that were tailored to their specific needs. We also supported provider organizations such as regional and district accredited drug dispensing outlet associations, and we also supported the Private Nurses and Midwives Association of Tanzania's Savings and Credit Cooperative to better support their members. Further, Shops Plus worked with financial institutions to strengthen existing practices as well as collaborate with them to design and tailor new financial tools and new financial products. Some of these included equipment buybacks and pharmaceutical wholesaler partnerships. And what this did is that it resulted in an increase in private sector's ability to access the resources needed to invest and grow their businesses. In the picture, you'll notice CRDB staff, and this was at a training that was facilitated by Shops Plus to familiarize the bank staff with private health sector. Mr. Toy from CRDB will shed more light on the bank's experience as well as some of the challenges they faced in the next session. Next slide. So shifting gears a little, the previous slides have focused on leveraging access to finance to strengthen business models for health facilities as well as for retail outlets. In this segment, we take a bit of a turn and speak to strategies implemented by Shops Plus to strengthen the business model of a supply chain actor, Tmac, who is Tanzania's only local social marketing organization. Now, there is no denying that Tmac serves a very important function in our health market. They make lower cost, high quality products available in the private sector. As social marketing organizations, social marketing programs evolve in Tanzania as well as globally, our support to Tmac has focused on two very specific areas. One is supporting the growth of a fully sustainable social enterprise division, including the introduction of new products and new brands. And second is to strengthen the efficiency and effectiveness of Tmac's social marketing division. My colleague Sumitra will explain a bit more about what this work entailed and some of the results achieved. Next slide, please. So to increase the availability of priority health services in the private sector, Shops Plus sought to capacitate private providers at facilities as well as at retail pharmaceutical outlets with skills and with supplies needed to offer a broader range of quality family planning, maternal and child health, and HIV products and services. This included strengthening pre-service training at private medical training institutions so that graduates entering private sector employment post-graduation were better trained and capable of offering high-quality care. We also partnered with government and provider networks to train private providers on services such as implant insertion, implant removal, nurse initiation and management of ART, and basic and emergency obstetrics and newborn care. Shops Plus further brokered commodity partnerships between private facilities and the public sector so that private providers could access commodities from the public sector supply chain and in turn offer them with a service charge. These partnerships also saw to it that private providers were able to receive supportive supervision needed to ensure high quality service delivery. Ligmas, who is from the Office of the Director of Nursing Services, will discuss some of this work in more detail during his presentation. Next slide, please. Finally, but equally important, we sought to strengthen commercial markets for priority health products. A major component of this work was tied very closely to our stewardship efforts that I had mentioned a few slides back. We generated data on the total market and then subsequently worked with our government partners to use that information to adopt a total market approach for the condom and family planning programs in the country. In addition, as Peter will speak to shortly, we also sought to support the introduction of quality assured products in the private sector at affordable prices in order to ensure that clients who preferred a private sector source for their health care would find what they wanted in the private sector. Next slide. While there's still some work to be done as we move towards the next frontier of engaging private sector, the efforts that I have just walked you through have already started generating substantial changes in Tanzania's health system. Our partnership with financial institutions have mobilized up to $10.6 million in private financing for private health providers. We trained approximately 2,500 private providers and retail outlets on topics related to family planning, HIV, and maternal and child health. These facilities and outlets we supported delivered over 300,000 priority health products, such as family planning methods, malaria commodities, and child health commodities. They also delivered over 14,000 priority HIV services. Shops Plus also helped to update 9 policies to create a more enabling environment for the private health sector. And further to that, we supported the registration of 3 new products, including the first commercial HIV self-test product and 2 injectable contraceptives for commercial distribution. Next slide, please. So to give you a better sense of what this work has looked like on the ground, including challenges encountered and work that is still left to be done, we wanted to give our partners the flow. For each of the 5 areas I just discussed, we have a representative who will talk you through a summary of the challenges they faced, the strategies they pursued, and their plans going forward. Next slide, please. So to start, we will hear from Machumu Miyeye, who is from RCHS, And Machumu will talk to us about the work they did to support, the work we did with them to support public sector to establish strategic and effective approaches for stewarding the total market. Machumu, karibu sana.
Asante. Good morning, everyone. Can you hear me?
Yes, Machumu, we can hear you. Please go ahead.
Okay, thank you very much for giving me this opportunity. To start, I would like to apologize. My voice might be a little bit not clear because I have a bit of a flu. So, as previously introduced, my name is Machumi. I work with the Reproductive and Child Health section as a National Commodity Security Coordinator. I just want to start by giving you a bit of background on how our capacity was built to improve our stewardship over the total reproductive health commodity. In 2016-17, several assessments highlighted the market gaps in the reproductive health space. Most pressing, several products relied extensively on global donors for supplies, and they were concerned that changes in resource availability at UNFPA could affect our commodity security. As a steward of the FP market, as RSHS, we recognize that we needed to better engage our private sector to strengthen the overall market and ensure continued access of the services. However, the changes in resource availability at UNFPA could affect our commodity security. The private sector, commercial sector only had a limited presence, and the social marketing organization most present in the market were undergoing substantial changes. With the support of Shops Plus, we recognize that we would have to address three challenges in order to apply a total market approach and increase private sector involvement. First, we had to build trust between the public and the private sector. We started by strengthening platforms for dialogue, inviting a more diverse range of private sector actors to have a seat at the table, and increasing the frequency and utility of those engagements. To date, we have successfully expanded private sector representation in the national level forum and several technical working groups. For example, we had the National Reproductive Health Commodity Security Working Group, whereby there is a representation from private sector actors, also the other forums like the family planning technical working groups. We used to invite them in case they had things to share, or the members just want to know what is happening. Secondly, through the engagement, we next work to facilitate a common understanding of the market and the priority gaps to address. We had a limited insight into commercial sector activity and needed to conduct market research so that we understand where we need to most target government efforts and where we could create more space for private sector to act. Finally, we needed to change our behaviors and motivate others throughout the public sector to change as well. This involved using the data we generated to improve our resource planning and targeting, and embedded total market principles into relevant policies and programs so that this effort would not be run on a single project or individual and could be sustained over the long term. Next slide, please. For the first time, through this effort, government has extended its stewardship mandate to cover the total market for family planning products and condom. While the market is still evolving, we have achieved several notable outputs that are shaping how we continue to work in the future. For example, we have incorporated TMA principles into 8 policies and strategic documents. So for now, as the ministry, we have managed to incorporate total market approach principle into different strategic documents like the National Costed Implementation Plan for Family Planning, of which is the year between 2019 through 2023. Also, in the One Plan 3 strategic document, we had also included the TMA principle over there. Also, we supported 11 districts to develop total market approach action plans that they are using to improve their engagement with the private sector at the subnational level. And also we are routinely generating and using private sector data to inform our commodity quantification, which is informing our strategies to achieve the country FP 2030 commitment. As we know, even in the last week we did the national quantification for the RSHS product. We also invited the private sector actors to share also their plans, so as the nation or as the ministry to know the total commodity needs all over the country. Over. Thank you.
Thank you very much, Mie. Now we will hear from Mr. Toy, who is from CRDB Bank, the project's partner for the work we did to improve private provider access to finance. Mr. Toy, the floor is yours.
Thank you so much. Good morning, guys. As we all know, the private health sector plays an important role in the provision of the health services. Given this, there is a need for the sector to continue to grow, which results in a need for loans to finance growth and investment. One of the challenges we see is the availability of loans for private health care sector lags behind what is required to fully meet the needs of the Tanzanian population. Of course, CRB understands the importance, and the bank is committed to ensuring the Tanzanian population has access to good quality health services. To this end, CRDB has been investing in the sector, which is why our partnership with Shops Plus has been so valued. Next one. CRB and USAID initiated the partnership through a loan portfolio guarantee agreement. The agreement provided 50% guarantee to any loan the bank made to private health sector, meeting certain requirements. As I will mention, the partnership with Shops Plus has resulted in a full utilization of the $2.8 million guarantee, and the bank and DFC working on finalizing a second phase of $8.8 million guarantee. Shops Plus and the bank's partnership started in 2017. The bank received support from Shops Plus aimed at utilizing the guarantee. And these are very few among others that Shops Plus did. One was support in developing a loan appropriate for the sector. These loans include health equipment buyback arrangement with local suppliers, developing of a product offering focused on women-owned health facilities, and we are now looking at potential work with others that may include partnering with Maisha Med, a company that provides adults with an electronic inventory management tool. Many facilities do not have financial records or business know-how, thereby representing a risk to bank. Shops Plus business training is considered valuable as it contributes to the access to finance and skills required for these facilities to grow and increasing availability of services and products. On the issue of the bank staff, Shops Plus worked with our sales and risk team in developing pipeline of potential clients and providing support in evaluating credits. This has resulted in an increasing level of focus in the sector and in understanding complexity of the health sector. Also, we could also say that CRDB and Shops Plus have worked in an expanding partnership with other actors in the health sector. Of course, the FBO, social franchise, that is the PSCI, equipment suppliers, those are among others. Maureen, next.
Thank you.
Now, so CRB working with USD and the DFC has been able to generate over 175 loans. This is partially accomplished through the business and financial management training that has been provided to owners of the health facilities, as well as the work in developing products and sales approach. Overvaluing this activity was the loan portfolio guarantee. The Tanzania mission and CRDB saw the opportunity to develop a finance through a solution by addressing collateral constraints, which is faced by the health sector. Working together, a guarantee that covered 50% of the risk was implemented. The impact has been an outlay under the program of $10 million. These funds have been used to expand facilities, allowing them to save more of the population, purchase equipment to offer additional services and improve quality, and provide financing required to purchase pharmaceutical products demanded by the population. So as a result of this, the Tanzanian population access to medical services and products has improved. And we realize the private sector plays an important role in this. So the bank continues to move forward with a commitment to the sector, having recently signed a new loan portfolio guarantee. So in this one, this is what we can say about CRDB in general and the partnership that we had with all the partners involved. Maureen, we thank you for this opportunity, and hopefully the partners have understood what CRDB was and has been doing in future. So we're looking forward to being a very good partners in this, and we thank you for this opportunity.
Thank you very much, Toy. Next, we'll hear from Sumitra Ghosh, discussing how Shops Plus has strengthened the family planning market by supporting Tanzania's only social marketing organization to establish a social enterprise arm and expand their product portfolio. Sumitra?
Thank you, Maureen. Good morning, my fellow panelists and ladies and gentlemen. So as Maureen put it, Shops Plus supported Tmac to build a fully sustainable social enterprise arm and strengthen social marketing strategies. And in combination, we supported Tmac to deliver more for less donor funding. The USAID Social Enterprise Support Activity, in short, USESA, is the USAID Tanzania's flagship project to successfully demonstrate the impact of transitioning traditional donor-dependent health delivery programs to more financially sustainable models. The project has been working in Tanzania since December 2016. After completion of first 3 years, the project was extended for another 5 years. Tmac, on the other hand, through USESA support, has been aiming to increase measurable behavior change through access to and use of priority health products, ensuring financial viability, using a combination of social enterprise and social marketing approaches. Shops Plus, in consultation with Tmac and USAID, is supported in 3 specific areas. Firstly, to expand Tmac's product basket and improved its overall sales performance to increase sales revenue and cost efficiencies. Secondly, to strengthen technical, organizational, and financial capacities of Tmac to meet these twin goals of making social enterprise arm sustainable and increasing health outcomes through a stronger social marketing and social behavior change program. Lastly, to institutionalize a business diversification process by which Tmac could explore and shortlist new business areas for long-term stability, as well as strengthening leadership in the health market development. Next slide, please. So let's now look at the achievements and also the challenges that we encountered briefly. As you can see in the slide, evidence shows this assistance created the pathway to Tmac sustainability and also demonstrated the relevance of USAID in the global context. Let me demonstrate this through a few examples, please. Number one, as you can see, Shops Plus support expanded product basket in terms of active and pipeline products, covering a variety of health areas, including even diagnostics as an added revenue stream for Tmac. Most significantly, it institutionalized the process that Tmac would use to sustain new product introduction in future. Secondly, these new products not only accounted for 22% of annual revenue in fiscal year 21 and registered a year-to-year growth of 28% over fiscal year 20, but it also gave a new impetus to growth of overall sales performance, as evident from growth in access and financial viability of the core family planning and HIV/AIDS products. Continued efforts in this context would help achieve Tmac and USAID, the respective goals. Thirdly, Shops Plus use the proprietary social marketing organizational development assessment tool, in short, MODAT, helped Tmac to not only establish a baseline score to measure progress over time, but also identify a dozen of institutional capacity gaps covering technical, organizational, and financial management areas. Most significant of these affecting the sustainability of Tmac were as follows. Let me start with the technical ones. Firstly, the weaknesses in commodity procurement and reordering process, a very, very significant function or aspect of a social marketing organization, which often leads to, if it's not handled properly, leads to frequent stockouts. And this was a problem. Second, increased focus on sales growth to meet social enterprise goals led to reduced emphasis on equity of access, behavior change. This misled the Tmac team to chase profit rather than the social profit. Number three, the change in perspective, from this whole, just the health outcome, but also sort of making it viably caused, a lot of trade-off between investment on research, evidence generation, vis-a-vis giving margins to the trade or giving incentives to the sales to increase the sales performance. And if we look at the institutional and other areas, we found that the Tmac lacked strategic focus and to an extent skills on, to build that corporate communication and business development with focus on its sort of strength areas like social marketing, social behavior change, and also the aspects of health market development in overall terms. Lastly, we found the Tmac programs and the organization lacked emphasis on gender mainstreaming. So given the criticality of these issues, Shops Plus in consultation with Tmac leadership prioritized these 5 gap areas and addressed using its internal experts, as well as the external resources, for example, by using Irish Group, a global leader in gender, and Shops Plus global partner to address the gender mainstreaming for Tmac. Use of SMODAT will help Tmac strengthen institutional capacity to deliver improved health outcomes in future days. But more importantly, lessons from it can be used for strengthening other local organizations who can be potential contributors to the development of Tanzania health market too. Lastly, Shops Plus assistance to start with, helped Tmac to secure 5-year extension for the USAID project. In addition, Shops Plus worked very closely with Tmac's social enterprise arm to identify new business opportunities. For example, condom manufacturing, if it can be done in Tanzania, aggregation of private health providers, innovative digital technology solutions for efficient and affordable service delivery, and commercialization of some of the in-house technical support services, which were Tmac's traditional strength areas. The process has been laid out. Following this, Tmac would be able to set up its new strategic business units for increased stability and health market leadership. This would also help Tanzania and other countries in the region to access commodities and new private sector-based service delivery models, which are designed and demonstrated locally and hopefully more cost efficiently. That said, let me touch upon a few big challenges that we faced. Number one, transitioning from fully donor dependency to self-sufficiency for sales and marketing operation for a traditional social marketing organization did pose challenges. It took a while for the perspective to, seep in, to set in people's mind and understood and sort of then implement the activities accordingly. It led to some misunderstandings and internal conflicts too. Thankfully, over a period of time, we're glad that Tmac has been able to bury the past and move ahead. Just like any other organization and programs, COVID-19 posed significant challenges in terms of particularly product sourcing, registration, procurement, launching, as most of the suppliers were based in China and India. This caused significant delays in planning and completing new product launches and zeroing on new business areas to be launched. It also affected capacity building efforts, as most of it had to be done remotely, providing, of course, it provided new learning opportunity for all of us to do all these things online. But going forward, it is not likely to be business usual again. So Tmac and USAID need to develop a risk mitigation and contingency plan to stay on course so that the USAID goals can be met within the time frame. Thank you very much. And I am looking forward to questions later. And thank you very much, Maureen, for this opportunity.
Thank you for sharing those interesting insights, Sumitra. So next, we will discuss some of our private sector capacity building strategies. And Samuel Ligmas-Koyo will highlight how Shops Plus capacity building efforts, as well as work done to facilitate commodity partnerships and referral partnerships between private providers and the public sector, has resulted in an increase in access to priority HIV services. Ligmas, you're welcome.
My greetings to everyone. Thank you, Maureen. As you introduced me, I'm Samuel Ligmas-Koyo, the National Pneumatic Coordinator from the Ministry of Health, Community Development, Gender, Elder and Children, the Directorate of Nursing and the Midwifery Services. I would like to tell this that the Ministry of Health, Community Development, Gender and Children still facing critical shortage of human resource for health, with about 53%, and the task sharing policy and task sharing at large remains the best option to universal health coverage. So today, I will take you through our work that the Shops Plus project and the Ministry of Health, as through the Directorate of Nursing and Midwifery Services, collaborated to support the task sharing policy implementation for HIV services in the private sector. Tanzania launched the NIMAT in 2018 in line with the task sharing policy guideline for health sector, which was developed and endorsed in 2016. NUMAT, as the nurse-initiated management of antiretroviral therapy, empowers professional nurses to initiate antiretroviral therapy to people living with HIV and AIDS, and to manage their care at primary level health facilities, care clinic, and this improves access to care without significant increase in human resource. However, in order to introduce new services, the private sector needed to access to HIV-focused in-service training and the relevant commodities, both of which were not accessible in the private sector. So with SHOPS Plus support, Department of Nursing and Midwifery Services worked to expand NIMAT to include private sector nurses at reproductive and child health clinics. These alleviate health system challenges that full hinder or impinge access to ART services, including shortage of medical personnel with knowledge and skills for management of HIV, and inadequate linkage and referral. SHOPS Plus, in collaboration with DNMS and regional health management teams and the council health management team, organized 3 NIMAT trainings between January to February 2021, one of each in Arusha, Dodoma, and the Mwanza region. The training covered key clinical areas including HIV counseling and testing at the entry door to HIV testing services and care and treatment services for someone to understand a HIV status, so that can be linked to antiretroviral therapy initiation. So we have initiation now of antiretroviral therapy conducted by these private NIMAT trained nurses, prescriptions, and referral of antiretroviral therapy for patients who are continuing on or current on care and treatment, monitoring their response, including monitoring their ARV side effects and the overlapping toxicities, and conducting appropriate referral to other interventions where necessary. And with SHOPS Plus, also we managed to conduct 2 rounds of supportive follow-up were conducted and to improve flow of necessary NIMAT commodities, increasing reporting rates, and promote supportive follow-up by district level coordinators. In this case, at the district, we have a district nursing officer and the district AIDS coordinator. So linkage of trainee providers with council health management teams aim to ensure sustainable commodity ordering and the reporting protocol through the CHMT to streamline the flow of HIV commodities, including test kits and antiretroviral therapy, to train nurses and midwives. Also, each providers conducted by district level coordinators. So, through that work, SHOPS Plus, in collaboration with DNMS, can I move to the next slide, please? DNMS, in collaboration, next slide, please. Yes. So, as we link from my previous slide, through this work, SHOPS Plus, in collaboration with DNMS, have trained 69 private nurses as a trigger to initiate and manage clients on antiretroviral therapy. So now this trigger of 69 private nurses, leading to the yield of 14,521 clients, and whom they tested 346 positive clients who were initiated on antiretroviral therapy. However, one challenge has emerged, and that is the need to institutionalize capacity with the private sector. Many private facilities have high staff turnover, and when staff leaves the facility, can no longer offer the services. So, under SHOPS Plus, we estimate that this happens about 30% of the trained facilities. And going forward, we will need to work on this challenge. By having said so, I would like to end my presentation there and leave back to Maureen and keep insisting on the task sharing approach as the remaining solution to improve accessibility of HIV services and other services, including reproductive and child health services to our people. Thank you, Maureen. Over to you, please.
Thank you very much, Likmas, and we look forward to further interacting with you during the Q&A and discussion session. So following this, we will hear from Peter Gondwe of SAEX, highlighting how their market development work in collaboration with SHOPS Plus facilitated market entry for Tanzania's first commercially distributed HIV self-test kit. Peter, floor is yours.
Thank you, Maureen. Good morning, everyone. Once again, my name is Peter Gondwe. I'm a senior sales executive and application specialist at SAEX. In this call, I have my colleague from SAEX as well, Hassan Huina, who is a sales executive on launch platforms and Orasure HIV self-testing kit. So to introduce SAEX as well, SAEX is one of the leading suppliers in medical, laboratory, technical, scientific instruments and services. So we'll present plans which are global market leaders in molecular, microbiology, hematology, histopathology, immunology, coagulation, point of care, and analytics. So we serve the healthcare providers through accurate diagnostic treatment solutions with experienced local support. Our partners in this are Orasure, who are the principal manufacturers of the HIV self-test kit, who have launched Tmac, PD, ZACE, and many others. So today I'll be taking you through the market development of the first HIV self-kit in Tanzania. So SAEX has been working with SHOP Plus in Tanzania since 2018 to advocate the inclusion of private sector in the HIV self-testing initiative in the country. This work began before the passing of the bill, allowing self-testing kits in Tanzania, and has continued over the years as the bill subsequently got passed, and HIV self-testing kit initiative began in 2020. So post-advocacy work, SAEX has worked closely with SHOP Plus and received support in various steps related to introduction of HIV self-testing kit through private sector in Tanzania, including registration, development of supportive market, and instruction materials in preparation for launching in the Tanzanian market. Next slide, please. Next, okay. So, following registration and development of marketing and instruction materials, SAEX and Orasure worked with the project to conduct steps such as HIV self-testing trade meeting that invited over 50 participants from institutions ranging from wholesalers, retailers, healthcare facilities, diagnostic laboratories to introduce the oral kit to them. Through discussions with the wholesalers and retailers, and other partners such as PSI, SAIX has been able to identify needs for implementation of HIV self-testing kit through the private sector, including training and pricing of the product of the local market. The trade meeting also included getting commitments from the different participating private sector wholesalers and retailers regarding stocking, commercial sale for the kit, and through those commitments, SAIX is continuing to recruit more pharmacies for the increasing availability of this product. SAIX is working with partners such as National AIDS Control Program, PSI, Pharmaceutical Society of Tanzania, to train and include more pharmacies in the HIV self-testing initiative in the country. And we'll continue to scale up Plus project. Thank you. Over to you, Maureen.
Thank you very much for that. Next slide. Great. So this is the next segment of our engagement this morning. And as our audience sort of organizes some of their questions, we encourage you to put them in the chat. So as you organize your questions, I have some leading questions for our panelists today, just to open this segment of the discussion. And I'd like to start with Sumitra. So Sumitra, it was very interesting to hear how far the work that Shops Plus undertook with Tmac has come. And, I'm sure there's still work that's still left to be done in terms of pushing the needle for Tmac's transition. Could you please highlight what some of this work would look like if our partners were looking at opportunities to direct resources in this area?
Thank you, Maureen. That's a very good question. So as I said, first of all, the three areas that we worked with Tmac, the product basket expansion, the overall sales performance improvement, and the business diversification for the overall organizational sustainability. In all three areas, our efforts were, not just understand and develop something, but also institutionalize those tools, the practices within Tmac, so that Tmac can continue doing those on their own. We continue to work together, and at any given point of time, any support which is required, we still sort of would be available. But having said that, I mean, in the context of an overall sustainability or a transitioning process to that overall sustainability stage, we must keep in mind that USAID is a very unique mechanism to demonstrate this whole successful transition of donor-dependent local nonprofits to sustainable social enterprise models. It's like a seed fund, it's like a seed fund for startups. It helps to stand on your feet, it helps to walk and then run. USAID's success would have implications not just in Tanzania, but also developing health markets across several middle to upper middle income countries. Hence, responsibility of creating USAID's success doesn't rest with any one party. It's a shared responsibility of the entire leadership and governance team of social enterprise arm, definitely. But it also rests with Tmac management and leadership team, the Tmac's board members, and not at the very least, but USAID's Tanzania team. A closer monitoring and guidance to the social enterprise arm by these leadership teams would really help achieve USAID's mission. And then over a period of time, we will see its relevance in the global context. I hope that answers your question. Thank you very much.
It does. Sumitra, you definitely raise quite a few interesting points. So for Mieye and Ligmas, who are our partners today from sitting here from the ministry, we wanted to know, post Shops Plus, what are some of the initiatives that you have put in place to sustain the activities as well as to sustain some of the newly adopted approaches to engaging private sector that you talked about during your presentations? Mieye, would you like to start?
Yes.
Thank you.
Yes, thank you, Maureen. To respond to your question, what we learned from this project is that the ministry, through RSHS, we have learned a lot from the Shops Plus project when it comes to engaging the private sector on complementing the government effort. As I mentioned in my previous presentation, that RSHS will continue to build the trust with the private sector, also facilitate a common understanding across sector by generating market data and aligning on key gaps, and we as well as continue to motivate action through the improvement of resource planning and targeting. With the support of SOP Plus, we are making informed decisions on commodity supply planning and forecasting through the collection of market data on distribution and trends in the private sector. The means to carry out these activities has been institutionalized through the Pharmaceutical Society of Tanzania, who we work with them closely when in need of information on the supply trend and the commodity activity. We are also fostering cross-sectoral collaboration and dialogue with actors from different sectors, sharing information and contributing to national policy and strategies through national forums such as technical working groups and special task force, as well as the subnational level. As I mentioned in the previous presentation, now we are collaborating with them in different forums like commodity security. We appreciate their contributions in that area since we know what they are doing. In case maybe we have shortages in the public sector, we know how to strategize and mitigate to ensure the service will continue to our people. Also, we have worked with other ministry departments, such as, because in this sector, especially for condoms, we are working very closely with the National AIDS Control Program, TAMISEMI, POLAG, the TACET, and the other implementing partners to ensure accountability as stipulated in our policies through a national total market approach implementation plan and district action plan, which allow us to steward to ensure our intervention are in line with the total market approaches principle. I hope I have answered your question. Over.
Thank you, Mieye. Yes, you definitely have. So, Ligmas, if you have any additional comments on this, please, karibu. And I've also seen, a comment in the chat box asking for maybe some insight on improving provider retention at private facilities. So maybe Ligmas, as you sort of add on to Mieye's comments, if you have any comment on retention at private facilities, could you please go ahead? Karibu, Ligmas.
Thank you, Maureen, and thank you for the nice question you have raised. The element of sustainability to the good work which is SHOP Plus have started to support the ministry to reach the target of HIV epidemic control. First of all, I continue congratulating you as SHOP Plus for the NICE project on leveraging of task sharing to private sector. Through this now we have seen that the good work which have started, we need to continue maintaining it so that our people, they can continue getting quality health services with increased accessibility to HIV services and health commodity flow in the private sector. So by ensuring this good work is sustainable, we are looking forward as we have the NIMAT National Implementation Plan to ensure that private sector are well engaged and using the available resources allocated through the ministry and other partners. If it could be from Global Fund to include private sector nurses, and get trained on NIMAT so that they can continue increasing accessibility of HIV services. And also on the area of commodity supply, we are continuing coordinating council health management team and the regional health management team to ensure that at the council level, private facilities are receiving HIV and AIDS supplies so that they can continue providing services, because there are many clients who opt for private sector. So we should not leave them behind. So we'll continue having them. And also through our supportive supervision, we'll continue doing supportive supervision in the private sector, also involving CHMT and RHMT. Also in our mentorship plan, also we will continue involving mentoring private sectors and trained nurses so that they can continue to keep them abreast with the knowledge and the skills. But again, with that, Maureen, I can see, and the panelists, I can say that there is also good work around that, which we've seen through Show Plus supportive supervision. When we are going with a round of couples of supervision to these facilities, we see there are good works also emerging as a green area in which maybe can be leveraged on under the task sharing policy. I've seen a part of sustainability. We can see there are issues of GBV and the VAC, which we have seen, like the issues of PF3, feeding by nurses, which can be leveraged under task sharing. And also, we saw from the feedback here, we saw the issues of men's engagement. We saw that there's a good opportunity in the private sector. That with this corner, you NIMAT trained male nurses to reach more men, and the men would like it to be reached, and especially in the private sector. We saw also was that opportunity, and also in terms of, we asked you also in terms of reproductive and child health. We saw that how we can leverage on unemployed nurses and midwives to deliver maternal health services to the community. All those we are looking forward for. And as a continued good work which we have started, so that this energy and the resources invested cannot be wasted. So those are the issues I can respond to now with regard to sustainability. I've tried to go perhaps beyond even showing exactly what are the green area when we are moving forward with sustainability issue. To NIMAT. Again, to the chat question, as you said, Maureen, you asked me that what are we going to do? Of course, we have retention guideline developed by the Directorate of Nursing and Midwifery Services, which we happen to share to some of the private sector, so that how best they can retain staff. So we see that we need to continue training in the part of health sector, and especially how best they can retain their staff, given that we are still having the challenge of unemployment. Nurses and midwives in the street, and the private sector is one which is helping to employ these nurses and midwives so that they can continue giving and serving our Tanzanian population. Thank you, Maureen, and over to you, and thank you to everybody.
Thank you, Ligmas, for that sort of in-depth insight. Asante sana. I'm moving to the chat. We have a question for Toy from CRDB. Toy, one of the participants would like to know if CRDB has in place any strategies beyond Shops Plus and DFC for ensuring continued access to finance, especially for small clinics and pharmaceutical outlets. Mr. Toy?
Thank you, Maureen. Good morning once again. I think I have to thank you all for the question that he has put over CRDB and the way that CRDB is going to be issuing facilities if we're not getting any guarantees from other partners that are going to be partnering with CRDB. Once and for more, we have to be very aware that CRDB is one of the biggest banks in Tanzania, having more than 246 branches all over the country. I think we are situated in all angles that CRDB, any community person that can be reached over. So that being the case, looking at the nature that the community of Tanzania is having on board, and the way that we have been issuing facilities for over. Remember, we started this one within 2017, and Shops Plus was not in partners with us before. But we were also issuing loans to these communities and to these facility holders and communities at large. So looking in overall totality of how CRDB is doing, we issue facilities to these more big communities which are requesting facilities to us without giving collaterals to some of them. CRDB is committed. Almost 5% of the total core capital of us can be issued to clients without collaterals. So that being in mind, we looking at the health facility. health societies which are not having securities. We issue them non-funded collaterals to us. So one, sorry, if I look at the way that we have been issuing facilities, 1 to 50 million, we issue with collateral which we call non-traditional collaterals. Anyone getting 50 million up to 300 million, we issue them with collaterals which are registered. So we also have partners which are guarantees, none other than, of course, DFC and the others which are issuing collaterals. We also issue collaterals based on the other guarantees that we have with CRDB. So if it happens that we don't get into partnership with other, with DFC or Shops Plus and the others, we will also continue to issue facility to the other, to these communities using other guarantees that we have on board, but at the same time, taking non-traditional collaterals that can help these people get facilities from CRDB. Thank you.
Thank you very much, Toy. We'll take one final question from the chat for SciEx, and then I'd like to leave the last 8 minutes of this for USAID to ask any questions, and then do a closing remarks by Jean Pius. So for SciEx, the question on the chat is if there are any scale-up plans in place for training pharmacies as well as to expand access to the HIV self-test commodity. So either Hassan or Peter, karibu.
Thanks, Maureen. So yes, we'll continue to support the training at pharmacies across the country. As you know, since our initiatives in 2018 with Shop Plus. We have been doing this supportive development of supportive market, which training is one of it. So we'll do that. Yes. Thank you.
Thank you very much for that that response. So we have 10 minutes on the clock. At this point, I'd like to hand over to USAID. Jean, please, if there are any questions from that end, and then we can go ahead and do closing remarks. We realize that there are some questions that we have not addressed within the chat, but we have noted them down, and we will reach out to these individuals, and we will also share our contacts in the chat, so that if there are any lingering questions or something that you want clarified, you can reach out to us, and we are happy to answer those. Jean, karibu sana.
Thank you very much. Can you hear me, Maureen?
Yes, we can, Jean.
Thanks. I really don't have any questions. I just would like to make some comments. Our colleagues from CRDB very rightfully noted that we had our first DCA with the bank. We didn't have much activity for the first 2 years, but thanks to Shops Plus, you fielded good people who could begin talking to the bank, and we came to understand each other's needs and challenges. And as a result, that first DCA was fully utilized within 2 years. And we're looking forward to continuing with the bank with other potential loan guarantees as well. So that's a plus for Shops Plus, and we really appreciate your support on that. The other thing is that it's so rewarding to see the support from the government agencies here for what Shops Plus is doing, because Shops Plus really has been established to promote private sector market expansion. And the way it was done is, your approach has always been, look, we're in this together, and the private sector has resources. If you give us some space, we can release some of that burden that we are all trying to make the challenges of better health outcomes, and we can support you in that. And so it's been really, really good to see that transition. And whenever we had meetings, Maureen and I would have meetings, we would talk about the challenges that our government colleagues would have, and we would say, how can we help move things forward? And so that is one of the greatest aspects of this activity, is that although it's very much a pro-private sector one, we always agree that the government is our colleague as well, and we need to make this a three-way conversation. So it's been a really, really good experience, and we're looking forward to, although Shops Plus is closing, we're hoping that another activity will come online very soon, and we can continue the same support to our government colleagues and also working with CRDB. So that's sort of my final thoughts. I don't know if anyone else from USAID would like to make a comment. They're certainly welcome to. But thank you, Maureen.
Thank you very
Maureen.
much. Yes.
Sorry.
Thank you very much for that, Jean. We appreciate it. As we wait for, to see, we have 6 minutes on the clock, so we'll wait and see if anybody has a verbal comment to make. We have a question here from USAID, which I'd like Sumitra maybe to take, if you can answer it in 2 minutes. So, Sumitra, the question is, based on our experiences with social enterprises, how does Tmac move forward without institutional donor support? Sumitra, do you have any comments?
First of all, no way I wanted to suggest that Tmac has to move without any donor support. I think the key point that we need to understand is there are certain activities within Tmac, for example, the sales and marketing of products, and these can be done without donor funding. However, there could be some products which still requires donor support in terms of commodity or in terms of social behavior change, communication or initiatives, demand generation, etc. And then there are health areas, beyond the family planning or beyond HIV/AIDS, where we still require funding to undertake social marketing activities of those products or services, or for that matter, creating that, social behavioral change in the society. So in other words, what I'm saying is that, it is not that Tmac needs to stop receiving any funding and they will become 100% self-sustainable organization. There is a coexistence that needs to be of these two models or approaches that need to be understood. So one is that, as the funding comes in areas which are the high need areas and the market is developed, it can be transitioned into a more sustainable form of operation where, with the sales revenue generated with the product or even from the services in future, Tmac can actually continue operating those self-sustainably. But there would be certain parts where you still require funding. I hope that answers the question. Thank you.
Sorry about that. Yes, thank you very much, Sumitra. That does answer the question. And like I said, we are adding Sumitra's email as well to the chat box. So in case there are any questions specific to that, please feel free to reach out. I'm going to pause just for a few seconds to see if there are any other comments from USAID, and then I will officially close this meeting.
Thanks. This is Nelly, also from USAID. I just wanted to add my reiteration to Jean's comments as well. That was my question, Sumitra, so thank you. Really just to thank the panel of presenters. Thanks to the SHOPS team. It's delightful to see a range of partners, which demonstrates the work that you've been doing with all these various stakeholders, hearing certainly from the government representatives and also the private sector. Is a great learning experience. We are happy about the work that you've been able to do, SHOPS Plus, and your questions have kind of alluded to the future. How do we continue with these initiatives in terms of the government support for private providers? Also, the questions I think which were raised for CRDB were critical ones. So really just a big vote of thanks to you all and the work that has been done by the SHOPS Plus activity over the 5 years. Over.
Maureen.
Thank you very much. So thank you all very much for joining us this morning. And I'd like to wish us all the best as we move towards the next frontier for private sector engagement. Have a good morning.